Hello, and welcome to the first Mental Health Matters education session. Each week, the session will last approximately 45 minutes and allow for 15 minutes of questions and answers. Viewers can submit questions at any time during the session by typing into the chat box, and those questions may have the opportunity to be answered. Please note, everything is confidential, from signing into the session to the questions being typed and being read live from the presenters. We really appreciate you joining us today, and we will talk a little bit about the session ahead. Today's education session is on psychiatric disorders and the COVID influence by Dr. Nathan Harper. Dr. Harper completed medical school at West Virginia University School of Medicine and his combined internal medicine and psychiatry residencies at East Carolina University Brody School of Medicine and Vidant Medical Center. Dr. Harper is currently the medical director of the Behavioral Health Unit at Vidant Medical Center and also supervises the Consult and Emergency Department Psychiatry Services and Internal Medicine Residency Clinic. We will now turn it over to Dr. Harper.
So I'm Nathan Harper. Nice to meet everybody. We're going to talk today about psychiatric disorders and the COVID influence. And so we'll go over kind of some psychiatric disorders that we see commonly even outside of the pandemic, but which may be exacerbated by the COVID pandemic that's going on at the moment. Go over different type of anxiety disorders, depressive disorders, what those feel like to the person, how we may be able to describe them, and a few other things. And I'd also like to give credit to Dr. Michael Lang, who developed most of this presentation and allowed me to use it for this, and gave me permission to use a lot of his slides and stuff that he had put together. So let's start out with objectives. So explain the developmental of individual to population level anxiety during pandemics. Review the diagnostic criteria and presentation of different psychiatric disorders. So we won't go over like the more technical words or language for the diagnostic criteria, since we want everyone to understand kind of what we're talking about. So we'll discuss it on a level that, everyone can understand what we're trying to say here instead of kind of our doctor's jargon maybe. Appreciate potential adverse outcomes from isolation over time, which I think we've all been isolated quite a bit during this with all the lockdowns and moratoriums on things like movies and restaurants. And then understand the most effective mechanisms for treatment and reduction of psychiatric morbidity during a pandemic. There again, we'll get into kind of more general recommendations. We won't get into like a lot of technical stuff. This talk was mostly developed for other professionals, and I thought it was a good topic, but we'll try to make things to where we all can to understand what we're recommending and talking about. So anxiety, we'll start there. Worry. So anxiety is a psychological or mental, physiological, which refers to kind of your body and how you're feeling, response to stress. So this may be normal, expected, and transient, which means there are situations where it's normal to be anxious, expected, and it can come and go. Anxiety can also be helpful. So if you have to study for a big test or exam, without anxiety, you might not study as much as you should, or the amount you should, or as long as you should. So we all need anxiety to be there. And so it's when anxiety becomes too excessive that it becomes a problem. And that may also vary from individual to individual. And actually, a lack of anxiety can also be a problem. So anxiety isn't something always to be feared itself or to be addressed every single time it shows up. It can be normal, it can be expected, and it can come and go. And then we also may want to say how this differs from fear. And so you can sometimes use these words interchangeably. Like some people may think of a phobia, like being scared of spiders. Doctors would classify that as an anxiety disorder, although to that person, that would be fear. But for the most part, fear is a sense of foreboding or dread, maybe, in response to an external object. Again, maybe like a spider. So anxiety and fear, although maybe sometimes hard to differentiate, they are not always the same thing. Pathological, which is another term for a disease state. So pathological or anxiety that we would consider like a disease differs from normal anxiety as well. So first of all, we could talk about autonomy. So may have minimal or no identifiable triggers. So a disease type of anxiety may not be triggered by anything or triggered by something that we may consider to be much less worrisome or stressful than it actually is. It may differ between normal anxiety and its intensity, so how severe it is. It exceeds the patient's or person's tolerability. So someone may become so anxious that they can't tolerate that anxiety at all. And that leads to maybe negative coping skills like using alcohol or drugs or something else. And then duration. And so normal anxiety, its duration could vary. Most of the time, the anxiety persists while the stimulus is there, while you're studying for the test, while the spider is in the room. Usually pathological or a disease state of anxiety will last even after that stimuli is gone. And then behavior, and we talked about this for a minute, impairs coping, causing disabling strategies. So most people, to cope with anxiety, if it's normal or expected, they will engage in a behavior to relieve the anxiety. So if you're worried about a test, to relieve your anxiety, you will study. And so for some people to deal with anxiety, they may do something that relieves the anxiety, but is also harmful and damaging. Someone who has an obsessive-compulsive anxiety disorder, who has worry about having germs or being contaminated, may wash their hands to a point where they damage their skin or cause very, very dry skin or other physical problems. So that's a situation where the anxiety in a pathological or a disease-like state can cause behaviors that are problematic. So that's just kind of a little overview of what anxiety is, how it differs from fear, and what makes the anxiety more of a disease-like process that doctors want to address. And then manifestations, or how anxiety might show up on the person. So physical symptoms, which is how your body's reacting, and what it says here is related to autonomic arousal. What that means is your nervous system becomes very heightened and very stimulated. So your autonomic nervous system is the part of your nervous system that's involved in responding to fear and anxiety or stress. It's often referred to kind of your fight or flight response. So you get in a dangerous situation and your autonomic nervous system is the one that takes over. And so some people may, think about getting ready to speak in public or to play a sports, like a football game, and that feeling you get right before you have to do it. That's your autonomic nervous system. So tachycardia means an increased heart rate. Tachypnea means you start to breathe fast. Diaphoresis is a fancy term for getting sweaty. And then I think we all know what lightheadedness is. So that's how your body may show that you're anxious. Affective symptoms are emotions. And so when psychiatrists and doctors talk about affect, we talk about your emotional response or the emotions that you're showing. And that may have a range of severity for people who are experiencing anxiety. Edginess, or feeling like keyed up, ready to go, tense, all the way up to terror, and then maybe a feeling of losing control, like things are spiraling out of control. You have no control what's going on around you, and you feel like there's nothing you can do. And so that's how the emotions may be displayed along with the physical symptoms. Next is cognition, and cognition is a term we use to kind of describe someone's thought process or how they are thinking at any given moment or time. So thoughts about emotional or bodily damage, which means the person may become very focused and the thoughts may just become very intense on what will happen to them emotionally or to their body due to the anxiety over, or let's say anxiety about getting sick. Or so your cognition, your thought pattern becomes kind of obsessed with what will happen to me if I get COVID, for example? What will happen to me if I get cancer or if I get sick? Or what will happen to me if this other situation happens? How will I suffer emotionally? Or what if I fail this test? My life will be ruined. I'll have to repeat this class. Or what if this relationship doesn't work out? How will I handle that? So someone's thoughts may become preoccupied with what consequence they will suffer if that anxiety, worry comes to fruition. And then obsessions, worry, and apprehension. Again, obsessing over an idea, obsessing over maybe being contaminated over a fear of a specific thing. So cognition is referring to how the anxiety affects your thought process. And then behavior, which is how you're going to act based on a combination of all these things. The physical symptoms, your emotional affect, how you're thinking will lead to behavior. So, for example, avoidance. So someone who has a panic attack every time they get in public will in turn avoid going to public. And compulsion, so someone who fears contamination every time they touch an object will wash their hands. So you can see how anxiety can cause your body to have physical symptoms, emotional symptoms, bad thought processes that lead to bad behaviors. And so relating this to the COVID pandemic, you could see how going out in public, not wearing a mask, having an exposure to someone who later tests positive could have all these manifestations of anxiety or even worry for a family member. Let's say a family member tests positive for COVID or has an exposure to coronavirus. You could see how you could become physically upset. Your emotions could get totally out of control, perhaps. Your thoughts may just go over and over about, are they going to be safe? Am I going to be safe? I've been furloughed from my job. Am I going to get that back? And then the behavior may be that you avoid going out in public or avoid doing things. So all these examples of how anxiety can affect you, we could all kind of relate to how coronavirus and the pandemic could affect anybody. So just an overview of that. Anxiety rises and changes during periods of sustained objective stress. It triggers that autonomic nervous system, that flight or fight response that we talked about. A stressor that is not easily understood worsens the reaction. And when this first came out, coronavirus was not easily understood. We were told that we shouldn't wear a mask. We were told that we should wear a mask. And then we were told we should stay 6 feet apart. And we were told that the vaccine may not cause full immunity. So in order to try to deal with the anxiety, a lot of time we look to try to get information, to try to figure out as much as we can about what we're facing. And in the pandemic, that wasn't always an easy thing to do, and we got several different opinions. You can see how a situation like this is leads to makes us prone to misinformation, which can only worsen things. So, and then people also will develop a plan for safety and action. So you remember when everybody made a big run on toilet paper. And so that anxiety about running out of toilet paper and not having it in your house led to people having cognitive thoughts of, I must go get toilet paper or we're going to run out. And their behavior was to run to the stores and buy all the toilet paper. So if you go back and think about the physical manifestations, the emotional manifestations, the cognitive thoughts and behavior, that is also an example of kind of how anxiety provoked people on a population level, not just individuals, to respond in a way that wasn't so, I guess, helpful, which was to go to the grocery store and buy up almost all the toilet paper. I remember that distinctly. And so people feel like they need some level of control. And so that's kind of one of the other issues with anxiety, is that people want to feel like they have control of that situation that's provoking it. And when you have a worldwide pandemic of an unknown virus and we don't know really how to treat it or how to respond to it, it's hard to get that feeling that you have or have some level of control, which can cause a lot of anxiety. So that's one way anxiety disorders can be provoked and worsened in the situation that we've been in. So we look at populations at greatest risk. And let me, again, go ahead a couple slides to see where we're going. So older patients, and this is referring to the coronavirus pandemic and people who are suffering from anxiety. So older patients with comorbidities, which means they have other medical problems like congestive heart failure, COPD, diabetes. They might have reduced strength physically and lack of resources. Children who hear about these things but don't understand and may look to their parents, and if they see that their parents are very anxious, they can also become anxious. And also, children often feel like they have absolutely no control about what's going on. People who have a history of anxiety already, even for people who cannot really readily identify the source of their anxiety beforehand, now they actually have a source of anxiety, and this may even heighten the level of anxiety they suffer on a day-to-day basis. People who are immunocompromised, and that means to say that their immune system doesn't work as well due to maybe a medication or a medical problem they have already, they can become more anxious too as they see this new infectious process that people don't really know what to do about. And then obviously healthcare workers, and I would like to add to this what we would consider frontline workers, or people who had to continue to work because they were considered vital during the pandemic. So they have continuous exposure. You know, were we able to get enough face masks? Were we able to get enough gloves? What were you doing at the grocery store to keep everyone safe and all the people running the registers clean there? So kind of our populations at higher risk are older people, people who are sicker, younger people, people who already had anxiety, people's immune system who wasn't working as well, and then those of us who still, our work either got more intense or perhaps didn't change during this pandemic. And then, so stigmatization. And so also to talk about this, how it relates to certain types of people with the virus coming out of China, there was certain stigmatization about people of Asian or Chinese descent. There are also mistrust in authority figures, or maybe trust in authority figures that weren't reliable, however well you want to look at it. And also healthcare workers. You know, did people trust us, or were they afraid to be around us because of our exposure, or because for once we actually didn't know what we were talking about, or we didn't know exactly what to tell people to do. Other people that could also be affected are patients who have psychotic illnesses, which means to say their grip on reality or understanding of reality may not always be correct. They're prone to sometimes feelings of paranoia, which means they think often they're being persecuted, or they may be delusional, which means they believe things that aren't supported by fact. And so when they may watch the news or hear news report about a global pandemic, that may feed into their already their disease process that impairs their understanding of reality and worsen their illness as well. Bipolar patients, which are patients that can suffer severe depression, or an opposite condition called mania, where they become overly excitable, overly energetic, and often very much less cautious about their behavior. So you could see how they could be affected by by depression, then becoming isolated or becoming manic and becoming less cautious about their behavior. And we spoke about delusions already. Some patients may incorporate or believe a delusion that they have the virus or are spreading the virus. Even both of those things might not be true. And we also are worried that after this is over, that we may have worsening kind of a pandemic of mental health illnesses that either are new or worse. So there's different types of anxiety, and it may help to clarify a few of these. So panic disorder, which is kind of what it sounds like, and it's when someone suffers distinct and discrete episodes of panic. So they can come and go, paroxysmal means that, they can be recurrent, which means they come back. Paroxysmal means they kind of come and go. So panic attacks. One panic attack leads to fear over the next one. So the person becomes more anxious in the future, not only of whatever provoked the panic attack, let's say being out in public or being exposed to coronavirus, but they also then become concerned about the next panic attack in and of itself. So it becomes a very vicious cycle. These attacks develop quickly and reach a peak within about 10 minutes, but they can last anywhere from 15 minutes to hours, which is very difficult to deal with. It affects women about twice as much as men. Maybe males underreport that, and males tend to treat that with alcohol as well. So it may be a bigger problem in males, although they may not say it as much and may treat it a different way. It usually onsets in our teenage years into the third decade, and it does run in families. So you can see how if someone, let's say, realized that they were around someone who had turned out to have coronavirus, they develop that excessive worry, that fight or flight syndrome that turns into a full-blown panic attack. And now, do they not also worry in the future that they would come into contact with coronavirus? They also have to worry that they'll have another panic attack, because those things are very uncomfortable and actually can be quite embarrassing, especially in public, because people tend to become very sweaty, panicky, they get pale, their heart races, and they don't want to be seen like that in front of people. So it's kind of a double whammy, as to which they fear the thing that caused the panic attack, but they also fear the panic attack itself. Generalized anxiety disorder, which is also pretty much exactly what it sounds like, which means this person worries about pretty much everything. And so anxiety and worry out of proportion to the situation, which means they're worrying a lot more and have a lot more anxiety about a situation than other people might consider to be normal or to be what's appropriate. It is pervasive, which means it kind of infiltrates all areas of their life. And so it may not relate to one specific thing. Usually lasts longer than 6 months, and the person feels like they cannot control it. And then 3 or more of the following things usually occur. They feel restless or on edge. They get tired easy because they're constantly stressed out and tense. They have difficulty concentrating because of the anxious thoughts that kind of preoccupy their mind. They're irritable. Their muscles feel tense. And they don't sleep very well. And so just as a kind of an add-on, when doctors diagnose this, they see it as a separate issue from other anxiety disorders. And so these patients may worry about not only COVID, they catch COVID, their family catch COVID. What if they get sent home from work and they get furloughed? How are they going to pay the bills? Their kids are getting virtual school at home, and what if their kids are falling behind in their grades? And so that one kind of situation, this coronavirus pandemic, turns into a pervasive worry about many aspects of their life. And it leads them feeling restless, fatigued, they can't concentrate, they're irritable, they feel tense, and they can't sleep. So this is a type of anxiety that's not specific per se, but can focus on a certain problem and how that problem could affect their life in many, many ways. And then we have social anxiety disorder. And so social anxiety disorder is someone who has a worry about being in public and being scrutinized, that they'll do something embarrassing or humiliating and worry about what other people will think about them. So maybe they'll trip and fall in public, or they'll do something goofy and the people will point and laugh. And so they may be worried that when they get out in public, it's going to be embarrassing for them. People will notice it and make fun of them or talk about them. And so that causes them to avoid being in public. The presentation can vary. It can be specific, like going to a public bathroom or public speaking, or it can just be in general, out in the public. It tends to develop when we're younger, in adolescence. It becomes most evident in college. And then those people can have marked avoidance of public situations or to those specific things. It's reported more by females in general, but more males tend to come to clinical situations or to come see the doctor about it. So social phobia may not be one of the anxiety disorders that affects people during the coronavirus pandemic because of the lockdowns and because of us not being able to go out and do things. But it's still an anxiety disorder that at baseline can be aggravated by other things. And then we have obsessive-compulsive disorder, and this may be one of the anxiety disorders that may be more exacerbated by an infectious disease process. So obsessive-compulsive disorder is when someone has an obsessive thought, a thought that they can't get out of their head. Let's use infections or bacteria or viruses, for example. So the person has an obsessive thought that anything they touch or they're exposed to will get a bacteria or a virus or some sort of microbe on their hand or on their person. And so that thought becomes overwhelming and all-consuming, and they become very anxious. To get rid of that obsessive thought, they do something physically, a compulsion. So the compulsion would be to wash their hands. That relieves the anxiety temporarily. Then they touch another object, another doorknob or another anything. The obsession builds up in their thoughts again. They become very anxious. To relieve that anxiety, they wash their hands again. And this cycle goes on and on and on and on. And so anytime you have something like this, a very communicable, contagious, airborne illness, you could see how people who have obsessive compulsive disorder, who have concerns about being contaminated, infected, this is a nightmare. And though for people who may just generally worry about those things, it could maybe perhaps push them into a situation where they start to develop this because they feel like they have no control and the information they're getting may not be what they feel is accurate. So technically, it's a recurrent and persistent thoughts, impulses, images that are intrusive and inappropriate, leading to distress. So we'll use the contamination example, but there's different ones. These thoughts and impulses are not simply excessive worries about real life issues. So they tend to be exaggerated, unlikely to be related to a realistic problem. So if it was a realistic concern that everything we touched causes contamination or disease, we'd live in a totally different world. So the idea of becoming sick or contaminated or being infected by touching any small or any object, I think most of us realize that's a little over the top. And most people with OCD know that too, but they still can't help it. So to relieve the anxiety, the person performs a ritual, the hand washing, that is unrelated to the stressor, which alleviates the tension. Persons recognize thoughts are a product of their own mind and are excessive, and the obsessions and compulsions are time-consuming, cause distress, or interfere with daily activities. And so if you've ever met someone with obsessive-compulsive disorder, you know that this is something that they deal with every day, all day. And so if you throw on top of this already excessive worry and concern and compulsions, a pandemic of an illness that spreads. Initially, we didn't know how or how easily or how long people were contagious. You could see all that worry and stress and lack of information could become a real problem for people who had this anxiety disorder already. And then there's PTSD, which is post-traumatic stress disorder. And so this is an anxiety disorder that's precipitated by being involved in, witnessing close to a traumatic, life-threatening, physically dangerous or violent event. Precipitated by a traumatic event, there's a threat or an occurrence of severe injury or death. Emotions involved include fear, horror, and hopelessness. Initially described back in Vietnam, and even before that, in maybe World War I and II, it was called being shell shock. And so it went on to, in the general public, be diagnosed as PTSD. Incidence in Vietnam vets was about 1 in 5 at the time, and a high incidence of immigrants from volatile areas have this. The lifetime prevalence, which means if you look at any specific period of time over someone's life, there's about an 8% chance that someone has PTSD. And the course can be varied. 50% of patients, it goes away in 3 months. For some people, it never goes away. And so PTSD can have its highest onset during war, sexual violence, or motor vehicle accidents. Less likely during a natural disaster or a family death or other accident, but it still can happen. Risk factors include people already have a mental illness, a personality disorder, a history of trauma or abuse, low intelligence, which means to say that their IQ isn't at a normal level, and then things that protect people from developing PTSD after one of the risk factors would be strong self-esteem, good social support, and feeling of external control. Where this may come in a pandemic is that if someone becomes extremely ill and winds up on a ventilator and has a tube in their throat and a large IV in their neck and maybe experienced chest compressions or maybe had to go through a very, very dangerous period of illness where they come close to losing their life, they could develop PTSD from this, or seeing a family member go through that. Having to see a family member suffer or become very sick or be intubated or go through these things could develop PTSD. So it's not unheard of to have patients who were in an ICU go on to develop PTSD, and we know quite a few patients with coronavirus did end up in ICUs. And so other things to consider are things like depressive disorders, and there's a lot of those, and so we won't talk about those as much as subtypes as we do with the anxiety disorders, but we use a book called the DSM, which is the Diagnostic Statistical Manual for psychiatrists to diagnose depression. So here's some of the symptoms of depression, and we'll talk about those a little bit more. A depressed mood, which I think is self-explanatory. Changes in appetite, so you could eat a lot, you could eat little. People usually feel helpless or hopeless or have feelings of guilt. They may have crying spells, thoughts of dying or not wanting to live. Psychomotor agitation or retardation just means that their body movements may seem very agitated and fidgety, or they may seem very slow or non-existent. So the person may seem to be sitting there doing nothing. And then anhedonia, which means the person has lost the ability to enjoy things they used to enjoy, fishing, reading, any hobby. So the depressed person often finds little things in life that they enjoy, finds things in life that they used to enjoy that they just don't anymore. They may sleep all the time or sleep very little. They may feel like they have no energy, that they can't concentrate, or the changes in the appetite that we talked about may lead to weight loss or weight gain. And so when doctors are screening patients for depressive disorders, these are the questions that we ask people. So this was a depression in the pandemic influence, was a survey online done back, and that should say 3/23/20 of 10,368 respondents. The survey assessed social vulnerabilities, work status, gender, race, and marital status, stressors like food insecurity, health status, assessment of fear, resource social ties, mastery of fate, which means level of self-control or how much someone feels control over their own life, and their level of optimism. And so the CSD was a score, was assessing their anxiety and their fear. Their average score was 16.9. So 30% had a fear score over 8. So over 8 was the cutoff for people who had excessive fear and worry. And so of those people, also greater than 30% had moderate to severe food insecurity as well. So this was a survey done of thousands of people back in March of this year during the pandemic. And a lot of them were scoring high on a test that was kind of scoring their level of fear. A clear pattern emerged that the higher depression was among those who were unemployed during the pandemic, those who were single, those who were female, and those who were Hispanic. And so one of the other things that the survey showed, that the people who had less resources, who were single and didn't have a partner, who were unemployed and didn't have a source of income, had a big effect on how much fear and how much worry they had during the pandemic. I'll skip this part of eating disorders, but I think it's important to mention that during the pandemic, food insecurity was a big problem and continues to be. Domestic violence also, I know that one study showed that, in the town, I think in Wuhan province in China, one of the main towns that was on lockdown for that entire year, after lockdown came out, their divorce rates skyrocketed. And so that kind of isolation and having people kind of cramped up in these kind of tight quarters with not a lot of outlets or resources or ways to blow off steam or to get out and kind of relieve stress led to a high divorce rate afterwards. And so there's also a concern that this lockdowns and these other things may lead to higher rates of domestic violence. So the concern is that, did this lead to higher rates of domestic violence? Home is not necessarily a place that's safe, and now we're making people stay there all the time, when for some people, getting out of the house was better for them. It happens in about one in three women have a lifetime incidence. And then the USNDVH, which is an organization that monitors and collects information about domestic violence, is seeing a spike in calls. And one of the recommendations that has come out for doctors is current recommendations during testing is to ask if the patient feels safe at home. And so what they're recommending doctors do during this time of lockdown and the pandemic is to add that to our kind of evaluation of patients, to assess for domestic violence while people at home and may not have as many options to get out and go and do other things, or to get away or seek safety somewhere else. Substance abuse. So something else that's been kind of aggravated by the pandemic is substance abuse. So the opioid crisis has been around for years now, and there was no thought that it would get any better with this. And as a matter of fact, it did get worse. And so the opiate crisis during the pandemic, there have been higher level of opioid use disorder overdose and deaths during the pandemic. Opioid use disorder, which is the OUD you see there, during the COVID infection and transmission. So having someone who has to go out to get money and then go purchase drugs and then use those drugs and sell needles and be put in situations where they're in contact with other people without really any social distancing, you could see how that could make the spread of coronavirus worsen and be harder to control in those populations. Again, lack of attention to distancing. MAT clinics, which was medical assisted therapy, which means to say patients who were taking things like methadone and Suboxone to help them stay off things like heroin or to get control of their opioid use disorder. Their group therapies got reduced. They were now doing kind of video conferencing with their doctors. They weren't be able to see it in public. And so that made access to care for these things and then access to follow-up for these things a lot more difficult. A matter of fact, there was just an email went out the other day that says the government is actually relaxing some of the rules for doctors to prescribe opioid replacement treatment or medication and treatment therapy, because the pandemic has made it quite a bit harder for people to get treatment. And then so lack of access to drugs, which means to say the person is having more difficulty maybe getting access to the legal drugs that they were taking, such as Suboxone and methadone, or becoming more desperate in their search for illegal drugs. As people were getting sicker, there was more attention to people being on lockdown, curfews, things like that. So it's another example of how the pandemic can aggravate already underlying illnesses and other social problems that are going on. And then social isolation, which is always a problem for mental health disorders. And so now we've just kind of concentrated that thing. So mental illness is very associated with food insecurity as well. Cross-sectional survey report from the Canadian Community Health System. This was a survey they did of 100,000 people. Respondents were split into patients who had food insecurity and those who had food security. And then they adjusted it and found out that there was about 18.4% women who were food insecure and 13.5% of the men were food insecure. And so when they looked at those men and women who had less food security, who couldn't get access to food, mental illness severity increased in direct proportion to their food insecurity. So more depression, more anxiety, worsening of bipolar disorder, worsening of schizophrenia. Insecurity incorporated into direct proportion to level of isolation. So the more isolated they were, the more food insecurity they had. And the impact was greatest for those with poor community ties and women, which makes sense. So in summary, when they interviewed these 100,000 people, those who had the most food insecurity also had more severe mental illnesses related to that, more severe mental illnesses. They were more isolated, and more of them tended to be poor, have poor community ties, and to be female. So you had the pandemic making mental illness worse, also making food insecurity worse. The food insecurity worse itself made the mental illness worse. And so this all became kind of cyclic in nature. And so how does being isolated make you more sick? So I'll skip over kind of some of this technical part. But they did a survey. It was 153 patients lifted from another study. So they had questionnaires for demographics, which means the information about someone where they live and who they are and their income, their health status, psychosocial factors. So if they were poor, who they lived with, how much support they had in the community, life stress, pet ownership, at onset and every 6 months. So they had these 153 patients. They would ask them these questions at the onset, and every 6 months they would ask them again. They would assess their depression with a Beck Depression Scale, which is a questionnaire, and their anxiety with another questionnaire. And then the result was 36% of them said they were depressed, and 45% of them said they were anxious. And so what they found out too is that their health status and stability from heart failure did not differ between the groups. So they are also looking at medical outcomes. And so what happened is that people who had more medical problems, who had medical problems and also were more depressed and had more anxiety, they felt more isolated and actually had higher mortality rates. So what this was looking at patients, looking at their survey scores, how depressed they were, how anxious they were, their kind of psychosocial backgrounds, their medical problems. And it appeared that the more depressed and isolated they were, the more likely they were to have a bad medical outcome and more likely to die. And so skipping ahead to think about some ways that we can do to support people. And so ways to support kids. Kids present with anxiety in different ways. They may be more irritable and crying. They may regress to being more immature. They may not sleep and eat on the normal pattern that they were doing. Their school may suffer. Their lack of interest in playing may go down. And I guess in older and adolescents, maybe drug use. Parents can do things like educate the child at their level of understanding, which the parents would know better than anybody. Reassure that you're there with them and spend as much time with them as you can. Limit social media coverage and a lot of the things they see on TV, perhaps that may seem doom and gloom. And then be role models. Keep a good routine, keep a good diet, sleeping, exercising, and doing things that your kids can see you do that help you stay healthy. And then for the older or very sick, one of the most important things is to be in contact. And we know from this pandemic, a lot of our older patients and family members got locked up into skilled nursing facilities and weren't allowed visitors. This was very devastating. One of the things we can do there as much as we can is to be in contact. however that works best, whether you're able to see them in person, to see them virtually, to talk to them over the phone, regular drop-bys in whatever way that you can, and help them with maybe things like being food insecure, as they tend to be one of those at-risk and vulnerable populations. Check in on their medical supplies. Are they able to go out and get their prescriptions filled? Are they able to go out and get the medical supplies that they need and able to go to their appointments? A lot of older people don't understand technology as well as we younger people can, and maybe they can't do the virtual visits. Can you help them with that? And then have contact information for their providers and help them stay in contact with those providers. And then for our colleagues and friends, and this will be our last kind of slide here, and not just doctors and not just nurses or healthcare workers, but for all of us who are involved that we're working on the front line and are still considered, to be vital and working. And as we go back to work, commiserate with your colleagues, which means kind of share in the burden and suffering. Talking always helps. Personal self-care activities. What do you like to do that you can enjoy, that's possible to do? Scheduling rest is critical, as we all need time to recharge, and then recognizing the signs of depression and anxiety in ourselves and our colleagues and our loved ones, and for us to reach out for help and to ask people if they need help. And so we can all help each other get through this, and don't be afraid to ask how others are doing. And if you are, asked by a colleague or a friend or family, be honest and let them know how you're feeling. And if you feel like you need help, there's different avenues for that. And, as we go on through the talks that we're doing the next couple of weeks, there'll be more to learn about that. So thank you for that. We're done with the presentation. And then if anybody has any questions, I'll be happy to try to help. All right, so first question, if a patient is having a panic attack, is there anything I can do to help in that moment? So with panic attacks, like we talked about, they can kind of come on suddenly, start over the course of minutes. They usually don't last longer than 15 minutes. They can last sometimes up to hours. That's uncommon. A lot of times people think that that may need to be treated with a medication immediately. I think one thing we have to remember is that even if you take a pill, your body has to digest the pill. It has to go to your stomach. It has to go to your intestines. It has to go to your liver, then your blood, and then your brain. So by the time someone actually takes a pill for anxiety, by the time it's worked, metabolized, and reaches their brain, it's usually been 30 or 40 minutes, and the anxiety attack is often over. And so responding with a drug or a chemical all the time is not entirely practical. And so some patients or people have learned different coping techniques to deal with anxiety attacks, with one of them being deep breathing techniques. So taking in very slow, deep breaths. Another thing that some people will do will get into a kind of a quiet, dark room. And so if that's available, so you're away from stimuli, there's not a lot of noise, there's not a lot of light, someone can focus on how they're feeling and how they're breathing and meditate for a few minutes. Telling someone they're going to be okay and it's going to be fine often isn't all that helpful. And so reassurance that the person is going to be okay, that you're there to help, making sure that they can help them maybe slow down their breathing and getting them somewhere where it's maybe quiet or isolated and away from the factor that might be provoking the anxiety to begin with. Any other questions? And so what I'll finish with is just a few more statistics just to go ahead and to talk about more about what this pandemic did with mental illnesses. They did do another survey, and it was done by the CDC back in June. And so what had happened is they asked patients compared to 2019 to 2020, what had changed. So 31% of the respondents said that they had developed some sort of anxiety or depression disorder in their terms. 13% had started or increased substance use. 26% had felt like they had stress-related symptoms, and 11% had said they had had suicidal thoughts in the last 30 days. That's about double normal rates. And then they also did a survey of parents, and 46% of parents in a survey felt like their kids' mental health was suffering, And then the CDC looked at ED visits in several hospitals, and compared to 2019, in ages 12 to 17, there had been a 31% increase in visits to the ED for mental health. So the pandemic often intensified or worsened a lot of what we see as common anxiety and depression disorders. We're learning more about it as we go on and how we're going to respond to those things. But I think it's helpful to be aware that because of our kind of lack of understanding of as this started, and people's lacking a kind of feeling of like they didn't have control over the situation, it led to worsening of a lot of underlying mental illnesses. And we should be very sensitive to that and look at our friends and colleagues and family members to be asking how we can help, and being cognizant of ourselves, of how we're feeling and how we're doing, and not be afraid to kind of ask for help if we need it as well. And thanks everybody for taking time to be involved in our talk today.